Sometime late last year, a previously unknown virus quietly began to spread. By the end of January, the virus we now know as COVID-19 had become a crisis. In a matter of weeks, hospitals were overwhelmed and medical workers pushed their limits as tens of thousands of patients rushed to be tested. Despite our best efforts, it wasn't possible to confirm every new case in time. A new hope emerged when people turned to a new technology. Like any infectious disease, the most important and urgent task is to tell who is sick. Normally, we need doctors to do that. To detect COVID-19, they found out two methods: nucleic acid testing and CT scans. CT scans are basically X-ray images of your body, and trained doctors can read these pictures and tell who might have a problem. But there are only so many doctors and too many scans to be read. Despite the around-the-clock work, it was simply not fast enough. An AI company in Beijing came to help. This is where the algorithm comes in. By dramatically reducing the time to interpret tests, the AI was able to buy hospitals precious time. Seemingly, there is nothing you can associate this place with a virus or medicine. But this could be where medicine gets changed forever. The story of a small AI company has proved that in the early stages of the battle against COVID-19. How did they do it? And what does it mean for doctors and patients? Let's find out. 小文你好，
你好，
这是一个肺部的 CT 影像吗？
是的，这是一幅肺部的肺炎的诊断结果影像。
So basically what AI can do is to help doctors and hospitals identify suspected COVID-19 patients quickly from all the patients that they're actually examining. So we can actually identify that this guy is actually highly suspected of the virus, and we should actually quarantine, we should actually start the social observation, and we can actually start to do the testing.
因为一个普通的 CT 下来之后呢，它现在的连续薄层的图像大概有300多幅吧，300幅到400幅左右。常规的，一般看一个胸部 CT 的话，扫描的话，你要完完整整的从看到写完报告，怎么也得需要10到15分钟吧。但是有了这个处理的这个 AI 软件之后，起码它在10几秒钟或者20几秒，它就可以把肺炎大概其的这个病灶多少，然后分布，然后呢都能告诉你。
It didn't take long for InfoVision's algorithm to prove itself in the fight against the new virus. Hospitals in China, including specialized clinics, quickly put the new tool into use. And as progress was made in China, the technology was adopted soon around the world. In just 2 months, Japan, Italy, Germany, and the US were also using the algorithm.
When our European team actually crossed the border of Italy, we were actually stopped by the patrol. And then what happens is that we actually show them the letters from the hospitals indicating that they want to use our AI. And then the Italian patrol, the military, actually says that, thank you very much for helping Italy in this very dangerous time. So I think this is exactly how I think AI technology should be utilized, so that it can actually help to staunch the spread of the virus, and the technology itself can be spread even faster than the virus, so which I think is the greatest beauty of this technology.
There are few moments in history that a new technology gets repurposed in so little time to serve so many. But that tells us the part that AI could and would play in our lives. It is powerful, it is fast, and most important of all, it is still evolving. The technology was not born in China, but it has been embraced by the Chinese. Many see COVID-19 as a destroyer, but it can also be an imperative for humans to upgrade their armor against new opponents wherever and whenever they arise.